Welcome to Talkbox. I'm Faroon.
I'm just Paddy B.
And in today's episode, we're going to be talking about healthcare in a three-part series where we discuss the UK healthcare, the US healthcare, and we'll kind of bring it together at the end. Don't forget to give us a like, subscribe, and if you have any comments for us, just leave them in the comment section below. And I'll just go ahead and hand it over to Patty.
Yeah, so obviously we're starting off with UK healthcare. I would like to first thank every NHS employee, janitor, doctor, nurse, anyone who works in an NHS hospital, NHS GP centre, just anyone that's been involved in helping with the ongoing crisis over the last months. What they have done is nothing but miraculous to the whole grand scheme of things, to the helping of us basically. But what the point of the video today is just to go through what the NHS is as an entity. Like, I want to go through the good points of the NHS, like the fact that we don't have to worry about it. If we go into A&E, if we go to our GP with something, we don't have to worry about a massive bill at the end of it. There's no extra cost on the face of it. Now, of course, we do pay for prescriptions, which is anything between £8 to £9 per prescription that we get. Now, that might be bad for some people, but comparing it to other places around the world, which we'll get to with America, it really isn't. With the NHS being built to be a socialized medicine for the country, it's actually produced a lot more innovation in medicine for around the world. So not only does the NHS provide us with healthcare, we also provide research and innovation to the world. And this is where the NHS for the UK is extremely good. Where the NHS is bad for me, and this is where I'll get Faroon to jump in at any point that he wants, is when you look at the way the system is set up, and you basically are encouraged to never go to A&E unless you absolutely need to. So you use it as the basis of the words. It's accident and emergency. You only go there for emergency. So you have to go to your GP. Now, if you've broke something and you need to go to the hospital, that's of course. If you're bleeding and can't breathe, that's of course go to the hospital. But if you've got a minor injury that you think's minor and you have to get a GP appointment, you could end up waiting a while for that GP appointment just based on the area that you live. Now, of course, that's going to be normal in any healthcare system. You got people that are unhealthy, you got people that need to get better, and they're going to clog up the system. But for me, where it kind of falls flat is you go to the hospital anyway, just ignoring the whole GP system. They won't kick you out because it's their duty to care for you, which is really good. But because of the society culture that we have going on at the minute, it doesn't work, because the GP is supposed to refer you to the hospital to help you, so that it cuts down on the times for A&E and it cuts down thing. So one of the bad things, and this is the reason why I led up to it, is 10 years ago we had on average a wait time in A&E between 2 to 3 hours, and that's now increased to 4 to 6. And yes, that's down to policy changes in the government, a lot of bureaucracy in the NHSs, but it's also just down to people. People don't want to go through the GP because they know they might have to wait a week. So realistically, the downside of that is just education of the people and what they can and can't do. Like, we have a new 101 number, is that right? That you can ring to get advice from someone on the phone, and that can really help. But like me, if I have an injury, unfortunately 101 isn't the number I call. I'm very much a mama's boy, so the first person I ring is my mum, who will then tell me to go to the hospital if it needs be. There are some times that I disagree with her. Like, best example of that is I was playing VR and I whacked my hand and I broke my finger. Now, I knew I broke my finger, but I've broke a finger before, and I know for a fact that they just splint it up, and that's all they do. So I'm not going to waste anyone's time when I can just splint it myself. And that's what I did. But obviously my mum was telling me to go to hospital to make sure it was okay. So there are times where, of course, you've got to kind of go with your own judgment. Now, I would always go on the side of caution. If you feel like this can do really bad harm for you in the future, always go to the hospital to make sure you're right, because that is our right as citizens. We have free healthcare that is basically based on us paying our general taxes. So that is pretty much the basis of our NHS. The only thing that I don't like, really don't like, is we're talking about this as the UK. So the United Kingdom has Northern Ireland,
Mm-hmm.
Scotland, Wales, and England. Unfortunately, because of the way the trusts are set up, now for me it's called the National Health Service. But when you consider what the trusts are, they're not really nationalized. There are little pockets of each area that control certain aspects of the medicine and the care that takes place in that trust.
Mm-hmm.
So this is the best example I can give. If you get cancer in Northern Ireland, there are certain treatments that you can get in England that you cannot get in Northern Ireland, because the trust in Northern Ireland has decided they don't want to use it. Mm. But not only that, it's also the trusts in England that won't release it. Now, what I've just said might not be completely factual. I'm basing it on a personal experience, which I won't go into on this video, but just based on that personal experience, someone in my family unfortunately got cancer. There was treatment that they could have got if they had have been here in England, but in Northern Ireland they couldn't get the drug, and they tried, and they because the trust didn't approve of it. Not approve. What's the correct word?
It wasn't in their system, I would suppose.
Yeah, it just wasn't in their system, so that they couldn't do anything. And that's where I feel like it's supposed to be a national health service. Are we nationally the UK, or are we nationally just England, Scotland, Wales, and Northern Ireland? And of course, that's a completely other debate with a lot of other things. But for me, if the politics and the bureaucracy of the NHS just pure and simply becomes about treating people, the NHS tenfold becomes better. Because for me, the NHS was better 10 years ago. Might not have had the research or the innovation that we have now, but in terms of quality of service, which is a very weird thing to give when it comes to your National Health Service, right. But unfortunately, that's what we have to talk about. It is just that. The quality isn't as good. Now, again, I would like to repeat that I thank every NHS staff member for what they have done during the crisis over the last few months. Yes. What they have done is a remarkable job. This is not on them. This is literally talking about the inner workings of the trusts and the government. I also don't want to go down the whole government route, because it's a different topic. But that is basically my feelings on UK healthcare. Like, if you got any questions based on what I've said.
Not necessarily questions. I think I agree with you on certain parts of the NHS, like prescription costs. That's number one. £8.50, £9 per prescription. I love it. I love it. I wish other systems would be like that. The availability for me to see a GP within a week. For me, for a minor problem, it should be a week.
It can be be longer.
A week, 2 weeks.
Okay, to put it into perspective, if I ring my GP, because of the GP that I know my GP, so if I ring them on a Thursday, I will most likely get an appointment that day. But there are GPs in this area that I know of people who have got an appointment and have literally had to wait 3 weeks. Yeah. And some of that is literally down to the person. The person hasn't realized, well, hold on, the walk-in day is this day. Any other day isn't a walk-in day, and the person reception hasn't realized what their problem is, and they need a specific person in. Because GPs work very much on a functionality of not everyone's in all the time. So one day is for this, one day is for this, and that's the best way a GP can work. Otherwise, they'll just get overrun with people. Well,
I've been in situations as well when I first came to England, where when I first got my GP, I got in to see the GP within a week. And then the GP called me and said, "Hey, can you come today?" 2 days prior. It didn't happen every time. It happened the first time, and then the second time I went to go to see my GP, it was a matter of a week and 2 days because I called on a Friday. So it kind of makes sense because they already booked up Friday, so now they gotta wait for the next week. So
absolutely, and that's just the GP system.
Yeah.
The GP system, when it works, is brilliant. But unfortunately, because of the way that things laid out in certain areas, it just sometimes falls flat.
Yeah, and also when I moved postcodes, it also changed my availability, so their availability as well.
That's just numbers.
Yeah, just numbers for clinics and whatnot,
which can be unfortunate, but that's just the way it is. And like one of the downsides, I think, of our socialized medicine system is you do not get to pick your doctor. I mean, you do have an element of you can complain. Moan's the wrong word. Complain. And if you don't like the care that you're getting, they will assign someone else. But you are hindering your ability to heal at that point, because you're basically having to wait for another doctor who might not be free.
Right.
But there is no system in place here to replace doctors, because quite frankly, what the care you're getting from the doctor you're getting, you might not like him, but he's going to try and save your life.
Give you the best care possible. Yeah, I mean,
exactly.
Whether it be Dr. A or Dr. B.
These are healers at the end of the day. That's what they are. Yep. And so for me, that is what the NHS is. I've outlined some good points and bad points. My bad points aren't really about the actual system itself. It's more about the bureaucracy and the politics that go in behind it. It's a bit unfortunate. If you would like to leave a comment down below on what you feel like I've got wrong, or what you feel like I could have researched better. I mean, some of this is based on personal opinion, and some of it's personal based on personal problems and stuff that's happened in the past. As someone who's very accident prone, I've spent quite a lot of time in hospitals, so I have some experience, but not all. And yes, so leave a like, please subscribe, and be ready for part 2 about American healthcare.
All right, bye now.